No matter what type of day I had, no matter what type of patients I've had to take care of, no matter how many codes I've ran, no matter how tired I am, no matter how bad my feet hurt, the next day I'm going to come back 100% and give my all and save lives.
So early on in the pandemic, a patient told me to go back to my country. And for reference, I was born and raised in New Jersey. I have spent my entire life on the northeastern seaboard of the US, and even if I hadn't, that language is not okay. It hurt me, but longitudinally, I think what shocked me the most was that I had even forgotten that my race was a factor to some people. And being able to forget your race on a day-to-day and navigating those interactions is a huge privilege, one that my Black and Brown colleagues don't have.
Within these past 2 years, and especially since the COVID-19 outbreak, I've realized I've become more confident in standing for what I believe in is right.
What I've learned most about myself is the power in my silence. As a girl, I was really shy and really quiet, and all my report cards for years growing up said, we love Lauren, but she's so quiet, we wish she'd participate more. And ironically, on the day of the rally, my silence said more than my words ever could.
COVID is formidable, scary, emotional, hard. It's just hard work to take care of it, but I feel I can help my unit, I can help the healthcare providers, and I can help our patients.
Being able to adapt is very important because things change by the hour, and time management is key.
I am a servant leader. I want to make sure that my staff and everybody running the COVID drive-thrus are educated and they are empowered with the information that we all need to be safe.
I think one of the most interesting things through this experience is how we've been making decisions and living in a world of scarcity and a lack of clarity.
We have to be flexible. We've had new protocols almost every day, and we've had to be extra communicative and just really in tune with when we're tired and we need mental health reprieve or physical health reprieve.
We all truly need each other, and we all truly need hope right now, and we need to feel that things are going to get better, and things will get better.
4 years ago, I had the opportunity to go to Standing Rock and work alongside the water protectors as a medic. That experience, combined with the experience in the ICU in New York, actually served to provide me with a great deal of education about other people, about the state of the world in which we live.
Health disparities are unfortunately part of our healthcare system fabric in the US, and this pandemic is shining a bright light on those.
Are we truly teaching and talking to where are the pains in the community? Where is it that there's actually a weakness, and how do we solve that?
I had a dream where I could hear all the voices in the world of people suffering from COVID, or I'd hear about another death, another Northern Arapaho person, another Navajo person, another nurse, another slaughterhouse worker, another grocery store worker. And then you hear about the deaths of George Floyd and Breonna Taylor and Maurice Gordon and Tony McDade, all at the hands of police. So I have learned how to keep working, even while I'm crying. And I've also learned to feel hopeful, even in spite of all of this, because I think this time's different.
This experience has taught me that I can be scared and strong at the same time.
I would say what I've learned about myself through this experience is that I'm probably stronger than I think. We're all stronger than we think. This has been hard. It's been scary and overwhelming, and I am breastfeeding an 8-month-old, and I was not sure if I could keep doing that.
I learned that I'm a lot stronger than I thought I was, and I see that I can remain calm during the chaos. Maybe inside, not so much, but
I'll be proud to tell my daughter someday what I went through when I was pregnant with her.
I have learned during this pandemic that I'm more resilient than I previously gave myself credit for.
I'd have to say I learned about myself and nurses in general that we're super resilient.
Nurses really run the show as far as collaborating with everyone in the hospital to take care of people. And so it's really a better situation when we have good teamwork.
when you help each other, your day goes better.
One of the things I've learned about myself throughout this experience is how resilient I am.
I'm more resilient than I thought. I can live off of 3 outfits for several months at a time, pack and unpack pretty quickly. But more importantly, that I feel so lucky that I found a career that I love and that is so meaningful to me and contributes back to society.
As I've reached the point where I now realize I have nothing left to prove to anyone, I understand that it's my turn to devote my energies to helping those still fighting to be heard, to have equal representation in the rooms where decisions are made.
We are always learning, always adapting, always changing. Even in the midst of all these unknowns, we still keep doing the best that we can every day and keep going.
It has been so exhausting but exhilarating, powerful and wonderful, and I just realized that I'm much stronger than I ever thought I was.
Giving up is never an option.
Tough times never last, but it's the tough people that do.
My name is Dr. Alia Jones.
I'm Amna.
My name is Annie Belcourt.
Dr. Ebony Jade Hilton.
I'm an emergency medicine physician,
an obstetrician gynecologist.
I am a nurse.
I've been a flight nurse for 6 months.
And I'm a badass woman.
I am a badass woman.
I'm Dr. Leanne Webb, and I'm a badass woman.
I'm a badass woman.
And we're badass women.
I'm a badass.
Badass.
I'm a badass woman.
I'm a badass woman.